Hey there, and welcome to Dementia Caregiving. This introductory course. I'm Kristen Galloway, a licensed occupational therapist and private practice owner in the state of Florida in the United States. I want to welcome all of you and thank you for taking the time and spending your resources, financial, time resources, energy resources, to learn what I have to share with you about dementia caregiving. Dementia and other neurological degenerative diseases are my passion as an occupational therapist. I feel like it's one of the ways that we as OTs can use all of our skills that address cognitive abilities, physical abilities, emotional and social abilities, and by supporting caregivers to facilitate function and daily activity for individuals with dementia. I think it's just a way for us as OTs to really open the floodgates, right, to what we have to share with people and really impact the greatest number of people. So that is why I have designed this course. That is why I'm so passionate about supporting caregivers and their work with dementia patients or individuals with dementia. So thank you again for supporting me and making kind of my dream a reality to be able to share this information. So let's dive right in. Like I said, I own a private practice in Florida where I work with lots of individuals who have neuro conditions, but mainly with dementia, with helping them and their caregivers to live happy, fulfilling lives, right? So how can we support these people in their own environment, in their own family structure, in their own caregiver unit, to be fulfilled, right? Dementia is a diagnosis. It's a collection of symptoms. And we'll talk a little bit more about kind of how that's different than just a typical illness that someone might have. But it's not, as some people call it, kind of a life sentence, if you will, right? So there are ways that people can live well with dementia. And that is kind of my main message here, is that there are things that we can do as caregivers, as people who interact with individuals with dementia on a daily basis, to make their lives better and more enjoyable and to make our lives much easier. But it's all in how we approach the situation. We kind of have to change our perspective in how we talk to these people, how we interact with them, how we work with them on a day-to-day basis, whether that's caregiving or professional, work with them as an occupational therapist or as a professional caregiver, or even as a family caregiver. How we interact with individuals with dementia will set the tone for how they interact with us, and how they experience life. So let's dive right in. I'm super excited to share this information with you. Again, this is useful general information about dementia and caregiving. It is not considered occupational therapy or medical advice. I highly recommend that you find a local occupational therapist who can work with you and the individual with dementia that you are caregiving for. It is generally covered by insurance, and it would be a huge boon to you to be able to have someone work with your loved one in their home environment, to give you specific examples and specific types of equipment or adaptations that might be useful for that individual. What I'm going to share with you today and throughout this course is general information that is useful for anyone who is caregiving for anyone with any type of dementia, pretty much at any level of disease progression. So these tips and strategies can be used whether it's someone with mild dementia, moderate dementia, or sometimes into the later stages. So let's jump right in. I just want to make sure everybody understands that this is not medical advice. Okay, here we go. So let's talk for a minute about what dementia is specifically. And I'm going to go ahead and share my screen with you so that you can see some of these slides that I've developed. Let me just hop in here, put on my trusty readers so I can see what I'm doing on the screen here. And I am going to share. All right, here we go. Hopefully everyone can see that. Make it a little bit bigger so you guys can see it a little bit better. Okay. So dementia is not a disease. It's a collection of symptoms that is caused by any number of diseases. So, as a lot of you might be familiar, there's, of course, the number one cause of dementia, which is Alzheimer's disease, which is caused by structural changes in the brain. Um, but we also have Parkinson's disease, which a lot of people don't realize can lead to cognitive dysfunction or dementia. So Parkinson's is perceived as like a motor disease, right? A movement disease, but it can also lead to cognitive difficulties. Lewy body dementia, which is very much different than Alzheimer's disease. We have frontotemporal dementia, multiple sclerosis, traumatic brain injuries, sometimes strokes can lead to dementia depending on the area of the brain that they impact. And so there are a lot of different causes of dementia, and the symptoms can be different for each person. And as most of you probably know very well, the symptoms can be different from day to day, even in the same individual. So it makes it very tricky, very difficult to work with individuals with dementia because we never quite know what to expect from day to day. So some of the common symptoms, of course, I'm sure you're familiar with memory loss. That is the biggest one that is the most talked about in media, in movies, in newspaper articles and blog posts, but it is certainly not maybe the most prevalent symptom or the most troublesome one, as you might have already discovered. So a lot of individuals with dementia have really tough time making decisions, right? It requires an awful lot of thought and energy for them to make choices and make decisions in daily life, and that can just simply be overwhelming. And again, that is part of the executive function or the front part of the brain that helps us to decide between safety and things that are dangerous, to sift through information and make choices, to prioritize things. So that is the part of the brain that is involved there. Some individuals with dementia, especially as we progress through to the moderate and later stages, have a really hard time recognizing things that are not safe. Okay, and we see this a lot in the mild to moderate kind of transition stage, where people don't realize why it's unsafe for them to be able to drive any longer. And that is a really tough kind of transition point where we have to work with those people to try to find ways, right, to keep them safe and to keep them off the road without creating kind of a catastrophic meltdown in the family and the caregiving unit. Another common symptom that happens in dementia that a lot of people don't talk about at all are sensory changes. So not only do we have actual vision changes, but we have visual processing changes that can be related to dementia. Sensory changes as far as the sense of touch, sensation, deep pressure, light pressure, textures can start to feel different, or maybe they don't notice something brushing up again. They don't notice bumping into things so much. And that connects also with kind of a sense of where our body is in space. It's that sense is called proprioception. And so a lot of times it can lead to movement disorders, difficulty walking, loss of balance, difficulty transferring or standing up from one surface and moving to another. So that sense of proprioception is related to our sense of touch, but also to our vestibular and balance senses, which makes it kind of tricky to address. These can be very scary for a person with dementia. Imagine vision changes, feeling off balance, losing kind of depth perception or peripheral vision, those are both very common in dementia. And so kind of feeling out of sorts in your body, right? And so that can lead to some of the behavior concerns, the dementia related behaviors that we'll dive into a little deeper, that can lead to refusing care or resisting resistive behaviors that we'll talk about later too. Another one is, and this tends to be as we progress into the moderate stage, is the loss of ability to care for oneself. So difficulty with activities of daily living like brushing teeth, bathing, sometimes even feeding themselves, difficulties with toileting, so incontinence or difficulty getting on and off the toilet, in and out of the bathtub, difficulty just being able to remember the sequence of events in order to get dressed, or take a bath. So these again are related to the cognitive decline, right? The lack of those connections in the brain that allow them to remember those processes. Okay, difficulty communicating. Now, this is a huge one, and this is one of the main things that we're going to focus on in this course is how we communicate with that individual with dementia to support them in their abilities to communicate. Because a lot of times we find that behavior, right? Sometimes when they get angry or frustrated, those behaviors that they exhibit will stem from a lack of ability for them to communicate their needs or their feelings or kind of what's going on with them. And so, because they can't communicate how they're feeling, they act it out. So behavior is always a form of communication, and we will dive deeper into that when we get into the communication strategies part of the course. And then again, segueing into that last point there on the screen, you can see changes in behavior. So some of these might be related to making judgment calls, right? Not being able to determine what's safe and what's unsafe, kind of losing the inhibition a little bit. So saying things that are inappropriate, in public. We have problems with people in later stages of dementia wanting to take all their clothes off, right, in a public place. So there are lots of things that can lead to the changes in behavior. But again, some of it is just the fact that they're having a difficult time communicating what it is that they want and need. And so we will talk much more about how to address that. So common symptoms of dementia, there are quite a lot of them, and then not all of them are related to short-term memory loss. So you can see there. What I always think about as an occupational therapist is, how do these symptoms affect that person's function? How does it affect their ability to navigate their day, to get through day-to-day life, to be able to do the things that they need to do and want to be able to do to have a good quality of life? So we know that dementia is progressive. We have those mild changes that happen at first when maybe family members don't even really notice that there's a change. Most likely the person notices, and that's why they tend to get frustrated and lash out in the very beginning before perhaps even having a diagnosis. Then we know we move into the moderate stages, where they start to have difficulty wayfinding. They get lost going to familiar places. They have difficulty recognizing friends and neighbors, maybe starting to not be able to do things for themselves. And then, of course, into the later stages where they need round-the-clock care. And I will post in the resources for this course, for this module in particular, a list of the different stages of dementia, Risberg stages, the 7 stages of dementia. And it's a really nice, succinct document that talks about kind of what kind of changes, behavioral, sensory, communication-wise, cognitive-wise, that you can expect at each stage of a dementia. Now, again, keep in mind that every individual with dementia is different, and different types of dementia, or the different underlying causes of dementia, can cause different symptoms in different people. And so just keep that in mind. It's just kind of a guideline. Again, generally speaking, what you might expect at each of those stages. But of course, it also affects the individual with dementia. It affects their ability to function independently. And we mentioned this in the last slide, their ability to be able to dress and bathe and feed themselves, and, manage their checkbook and drive to and from the grocery store and get through their grocery list and make a purchase. It affects their ability to do those kinds of things. So they need help to do to live, right? They can't live independently anymore. They need help to get through daily life. These loss of abilities can cause them to be extremely anxious, very frustrated. They lash out at their caregivers. They lash out at family members. And, if you take a minute and put yourself in that person's shoes and think about how you might feel if you realized that you couldn't do things for yourself, and that you were getting lost and confused and feeling overwhelmed all the time, how that might feel when you've been a responsible, productive adult for years and years and years, raised children, run businesses, taking care of everything that you need to take care of in your life. And all of a sudden you have this sense that that your life is spinning out of control, that you can no longer do that for yourself. So it's very concerning and upsetting to people who have either have a diagnosis of dementia or just begin to realize that there is something going on, even if they're not sure what it is, that is causing them to be out of control. And so we know that this affects the individual with dementia and their level of function, their ability to safely take care of themselves and get through their day. But they can't change. They can recognize that they have a problem sometimes, but sometimes they don't. There's a little thing called agnosia, which means the person does not realize what their limitations are, or where they have a shortfall in their abilities. So that is also very common in dementia. But early on, a lot of people will realize that they do have a problem. They don't necessarily know what it is, but they don't know how to change or fix it. They don't have the capability of doing that. And so as caregivers, we have to be the ones to make the change. We have to be the ones to kind of get up above, see the big picture, see the whole forest, right? Not get stuck down here in the weeds, but we need to kind of rise up, look at the big picture. And a lot of it is problem solving. A lot of it is us kind of looking at the big picture, looking at what we can change outside of that person to make their daily life easier, which in turn will make our daily life easier. Okay. So the good news is, again, there are proven strategies, scientifically based things that we can do, right? Ways that we can communicate, ways that we can change the environment, ways that we can change a task to support people with dementia to have a better quality of life, and to be able to function more safely and more independently. Again, not completely independently, but with our help to be able to do some things for themselves, right? Modified maybe. Which is going to give them some self-esteem, some self-efficacy, some confidence back, which is going to reduce anxiety and help them to feel calmer and help you to have a calmer, easier time as well. So these strategies involve changing the way that we communicate and interact with them, like I mentioned before, and we are going to dive into that in the next section. So I can't wait to see you there.